Another thing is, many children get seizures. That is what is called fits. For some people, they say that they have to use lifelong medication. For some other children, it does not get better even if they are given medication or use medicines. Is that a serious issue, sir? Is there a treatment for it, or can we go through with any surgeries?
People are not very much aware, but surgery is an excellent modality to treat seizures, especially in children who are on more than two medication to stop seizures from happening, and still the seizures are happening. 70% of those children can develop freedom from seizures for life with surgery. We have three different types in that, and one is disconnection, one is resection, and third is neuromodulation.
Okay.
These are the three main types of surgeries that we have for children who are not responding with the medication. As I said, the brain is developing right now, and if somebody is giving electrical shocks to the brain when the brain is developing, it is going to affect them badly. Seizures are nothing but electrical shocks. So like when you're touching a wire which is not insulated and you get that jerking, seizure is something similar to that, something happening inside the brain. And in order to stop that from happening, we need to find out where the electricity is leaking from. So in the brain, there are certain areas where the electricity leaks. If as doctors, we are able to spot the exact area where the electricity is leaking, we can go in and remove that part of the brain and stop the electricity from discharging abnormally and making seizures happen.
Okay. Is in the procedure that you mentioned, sir? You said that a small part is removed from the brain. So what exactly is it? Can it be removed just like that?
Oh, yes. So even though it may sound easy, if you open the motherboard of the computer and you decide to take out one part out of it and then you restart the computer to make it work normally, it is easier said than done. So it is a complex thing inside the brain, and that is why you need to come to an expert to find out how to get that done.
What you were just saying is that you do it by removing a small part from the brain. Age groups that have approached you, who is the youngest, sir?
So the youngest child that I have operated somebody with such kind of disabling seizures is a 5-month-old baby.
5 months?
Where we have disconnected one full half of brain from the other side because this baby's one half of brain was leaking electricity. The procedure is called hemispherotomy, where we disconnect one half of brain from the other half of the brain.
And the
baby is doing fine.
And can they go on with that brain?
Yes, the other half of brain, which is healthy enough, is taking over the function of the whole brain. And that happens in young children because we have something called as neuroplasticity.
Okay. Ante, would this be possible for adults to do?
It is possible, but in adults it can be very much disabling because the brain is kind of rigid and formed now, whereas in children the brain is still developing. So when we are doing something, the brain has the ability to autocorrect and make some modifications as the brain is developing.
I do not have much knowledge about this. As far as I know, every part of the brain, every single nerve, every neuron is connected to a body part, they say. But you are saying that you remove that part. Remaining
brain will take up the function.
Can it continue functioning normally, sir?
Yes. If 4 people are working at your home, one stops working, the other 3 will take over the job of the one that is not working.
Will there be any mental problems in the future, like stress or anything stress related?
Generally, the children tend to tolerate surgery much better than the adults, and they do really well on the long run.
Oh, very nice, sir. And really great things, sir. In fact, until now, many people are not even aware that such things exist.